Okay, I'd like to talk about a few basic forearm and wrist stretches. The forearm and wrist are frequently areas of pain and disability, and so a stretching program can be part of a program that helps in that area. And also stretching can help to prepare ourselves for a host of activities of daily living. I'd first just like to cover two terms that may not be familiar to some people, and those are directions of movement of the forearm and wrist into supination and pronation. Supination is turning the palm upward, and so you can think of holding a bowl of soup, supination, and then pronation is the opposite movement. To stretch those movements are also brought about by the forearm movement and the wrist, and so we can target those two areas. In order to do supination, targeting the wrist, you would hold the hand so that the force is all above the wrist joint, and hold it with, gripping it with the fingers of the opposite hand around the thumb, and then gently take the wrist into further supination. And so it's just coming to the end point there. And that's going to stretch both the forearm and the wrist. For most people, the wrist is more flexible than the forearm, so this is primarily targeting the wrist for that reason. Now, if I want to stretch the forearm, I would just move my fingers down so that find the wrist joint, and then 2 fingers above, 2 fingers below. So I'm on that wrist joint, but then the motion blocks the wrist, and then that becomes a forearm supination stretch. And so that would just be done in the same direction into supination, just taking it across and holding it at the end point. Be very gentle with these stretches and don't go beyond 30 seconds. It's possible to irritate the nerves in the forearm, wrist, and hand if you get too aggressive with these stretches. And actually the final 2 stretches that I'll show are actually special tests in the clinic for nerve irritation or even damage. So just be careful with these. So anyway, that's supination. For pronation, it's the opposite direction. We also have pronation that happens at the forearm and at the wrist. And so to target the wrist, you would grab above the wrist joint and take it into further pronation and come to that end point. And then to target the forearm more, you would again find the wrist joint, put 2 fingers above, 2 fingers below, so they're more or less on the wrist joint, so that blocks it and keeps the wrist joint itself from moving. Now all the motion is happening in the forearm. And so now I take that into further pronation, pronation or palm away direction. And just hold again, gentle force used and 30-second hold. You can do several reps on either side. The final 2 directions of stretch that I like to do for the wrist is extension and flexion. And so for extension, I prefer to use a table. I think that it's a little bit more versatile, and you can spread your fingers and really get the stretch to get felt into the hand. And so you would fix your hand on a table, lightly padded if you need to, and then simply take your forearm, move your body against the fixed hand such that you get increased wrist extension. Once you come to the end point, you can also do a little bit of shoulder rotation in each direction, and that can get at specific areas of stiffness on either side of the wrist. For wrist flexion, it would just be the opposite. You would fix your hand against the towel and then take your forearm into the direction so that you're flexing or bending your wrist. And again, you can do a little bit of rotation with the forearm in order to target different areas. Finally, if you don't want to use a table or don't have a table to use, you can still certainly do flexion, extension, wrist movements or wrist stretches. Without it, it would look like this for extension. Simply putting the palms together and then dropping the forearms, dropping the wrists toward the floor. And then for flexion, the opposite way, where you would start down at approximately at the waist with the backs of the hands together and then bring them up. But again, just realize that these 2 tests are specific clinical tests for irritation of the median nerve, and so don't get too carried away with those. Be very careful. As long as you keep it to a gentle pressure into the 30-second hold, you should be fine. But those are just some stretches to address the forearm and wrist.